So firstly, we're going to talk about activation mapping the atrial insertion. So activation mapping should map the retrograde atrial insertion point of the accessory pathway. So this is where the accessory pathway inserts onto the atrial side of the mitral or tricuspid annulus. And this site should represent the earliest electrical activity of the atria in any catheter. So if we have a look here, we've got a accessory pathway which is located between CS3-4 and 5-6, and then we've got an ORT circuit happening here. So if we look at the corresponding EGMs of this diagram, what we can see is we can see an RV catheter located in the RV apex, we can see an ablation catheter, and we can see a coronary sinus catheter. And this is confirmed ORT. So we've done our pacing maneuvers and we know for absolute certain that this is ORT. So that retrograde atrial activation is being mediated by an accessory pathway. And we get an idea of where this accessory pathway is in the heart simply by looking at the coronary sinus catheter. We can see that the earliest electrical activity in the atrium on the coronary sinus catheter is between 3-4 and 5-6. 5-6 and 3-4 are occurring simultaneously, and this tells me that depolarization is occurring between those two poles and then moving to 3-4 and moving to 5-6, resulting in simultaneous 3-4 and 5-6 depolarization. And so we already roughly know where that accessory pathway is just by looking at the CS activation. So then we can perform a transeptal puncture across the interatrial septum, put an ablation catheter or a mapping catheter between CS3-4 and 5-6, and then measure the electrical activity. And if our ablation catheter is in the correct position, it should have an atrial electrogram which precedes the atrial electrogram of CS3-4 and 5-6. And so let's have a look here. Here we can see an atrial electrogram on our ablation catheter. So this is the atrial electrogram and this is the ventricular electrogram. And we can see an atrial electrogram which is preceding CS3-4 and 5-6 by a little bit here. And we can also see a sharp potential occurring here. And this is what's called potentially a pathway potential. So a pathway potential is where you get ventricular depolarization occurring here. So this is ventricular depolarization. And then you get depolarization of the myocytes which make up the accessory pathway here. And then you get an atrial depolarization, so that's here. And so then we get atrial depolarization occurring. And so this pathway potential is also preceding atrial depolarization on the coronary sinus catheter. So this tells us that we're mapping in roughly the correct position. The electrograms at the site of accessory pathway insertion into the atrium look fairly unique. You will get both atrial and ventricular EGMs occurring at the position of the pathway insertion, and you'll get VA fusion. So you get a simultaneous ventricular and atrial electrogram because you have continuous depolarization from V and then immediately an atrial depolarization. So ventricular myocytes are depolarizing here, and then immediately atrial myocytes are depolarizing here. And this results in an immediate V electrogram, and immediately you'll get atrial electrogram occurring here. So we have what we call VA fusion. And this is unique to accessory pathways. This doesn't happen at the AV node because remember the AV node has all this delay. So there's a big delay between V depolarization and A depolarization. So you get VA separation during AV nodal. So it can be difficult to delineate what is actually ventricular signal and what is actually atrial signal sometimes when dealing with or mapping AVRT. So if we have an ORT circuit with our accessory pathway, which we talked about in the previous slide, and we have an ablation catheter located here at the level of the accessory pathway, we might have an ORT circuit occurring. So we have retrograde atrial activation via an accessory pathway, and then it comes back down the AV node to depolarize the ventricles, and then up the accessory pathway again. So an ORT circuit. So at this level here, on our ablation catheter, we may sense ventricular depolarization, because ventricular depolarization here is in close proximity to where our mapping or ablation catheter is. So we may sense a ventricular electrogram. So on the ablation catheter, we will see this ventricular electrogram occurring here. And then immediately after the ventricular electrogram, we may see evidence of accessory pathway depolarization. And this is termed a pathway potential. And a pathway potential often represents a sharp, high-frequency signal because it's directly beneath the ablation catheter, so it's high frequency and local. And it's often low amplitude because a pathway is often made up of only a few myocytes, so there isn't a high voltage being generated here. The pathway is only small. And so you often get a low amplitude but really high frequency pathway potential immediately after the ventricular electrogram. And that's probably this here, this tiny like uptick and straight down probably represents a pathway potential or pathway depolarization. And then immediately after the pathway depolarization, you're going to see atrial depolarization. And that's also going to be sensed by the ablation catheter because the ablation catheter is sitting in the atrium on the annulus. And so you're going to detect atrial depolarization occur immediately after.